Come and join me, Sandra. Take a seat.
Hello, hello.
Hi. So now I have the honour and privilege of interviewing our first guest, Sandra Gallina, the Director General of DG SANTE, the Health Directorate
Good
in the
morning to
European
everybody.
Commission. Sandra, thank you so much for joining
Thank you,
us
Helen.
today
Thank you.
on our 10th anniversary, no less, and our first time to have you on stage. So thank you for
Yes,
joining
thank
us.
you, thank you.
So we thought the last mandate was a particularly busy one for
Yeah.
the unprecedented volume of health files that it delivered. But this mandate appears to be maintaining that pace of new
Yes.
legislation quite unexpectedly. So I'd like to start by looking ahead at what's still to
Yes.
come, even this year. So next month in Strasbourg, the Commission will present a package of health files, the first part of the Biotech Act, the simplification of the medical devices rules,
Yes.
and the EU's cardiovascular health plan.
Yes.
And I was wondering, Sandra, can you give us a flavour of what to expect from the first part of the Biotech Act? Any sneak previews from that?
Yes, thank you, and thank you. Very happy to be here. So it must be something 10th anniversary, and I'm here, so it's good. Listen, before we go there, could we be reminded that today it's the 18th of November? What is happening on the 18th of November every year? Nobody knows. Yes, somebody knows. AMR Day. Antimicrobial resistance. This is not a jocular topic. It's quite serious. We have people that die because they can't even go through surgery safely these days. Pretty soon we will be in a very dire situation. The numbers are not good. Let me say that us as Commission, we are fully behind the Member States in trying to propel them into not only getting new antibiotics and more of that on the pharma review, but let me say in trying to have prudent use of antimicrobials. There's a joint action, and we put 50 million euros in that action. We have then also an action which is beyond this, which is for One Health partnerships. So it's one step beyond. It's 75 million euros. And with these two actions, we hope to steal the resolve of all of us to make good use of antimicrobials. Let me say that I'm very proud to be a One Health DG. I bestraddle the food side with veterinarians. The CVOs, the chief veterinary officers, are a fantastic lot, and they meet with public health authorities in what I call the jumbo. It's a meeting with Health Security Committee members and veterinarians to discuss issues like avian flu and all. So let us be reminded that antimicrobial resistance is a big topic and we need to fight it together. Now, I come to your question. And a small thing I was thinking yesterday night, what is more appropriate for, I would say, explaining to people what health looks today like, because you rightly said we go at a very fast pace also in this mandate. And there is a reason. So first of all of us think that health is an individual matter, which is true. You mind about your health, everybody minds about his or her health. But in reality, what we are seeing more and more is that health is a societal issue, a political issue. It's a topic that draws a lot of discussions because, you know, when you have challenges, and by challenges I mean not only the challenges of health, so we go towards, as Oliver was saying, we are going towards a new world in terms of health. It's not just a pill that you would need to take, you will need to have diagnostics of a certain shape, and diagnostics means the machines that MedTech represents, also the in vitro medical devices. So let me say to you, beyond what we are going towards, there is also competition from other priorities. I need not stress here that there is a big competition from the defense angle. So, you know, the budgets are scant and you need to fix your priorities right. And here, I would like to say that there are at least 3 axes that we have been pushing determinedly in DG SANTE, but I would say with the commissioners, Stella Kyriakidou and Oliver Varhelyi, we are pushing this angle of having, I would say, first of all, a set of resilient health systems, and this is about security, as you rightly mentioned. So, you know, getting the things that are needed and for all, possibly at an affordable price. Also, the other axis is prevention. So I would say prevention is very important. Why? Because, you know, with prevention, let me say mathematically, you reduce your expenses also. It's sad to say that prevention is also necessary from an economic angle, not just because we feel better and we don't have the diseases. And finally, I would like to say that we have also been very busy here in trying to have the supply right. And here there's topics that you, Helen, just mentioned earlier in the chat about, you know, how to get access to the medicines and to have a secure supply, security of supply. This is very important. So after that, I go into the 3 topics you mentioned, but let me say to you that DG SANTE is a big building site. What we are discussing here today is only half of my portfolio, of the portfolio of Commissioner Varhelyi, and so there's a lot that is happening. Let me zoom into the things you mentioned. So we start perhaps with medical devices, also just to have, I would say, a word with Oliver, who has been a force for good in this file in trying to project the vision of industry. So we will get out with a proposal for simplification, because let me say to you, what was clear to us is that the legislation needs to be very much on the side of safety. I want to stress this, safety of patients is the first concern, but at the same time, it has created inadvertently a set of issues that create shortages. And this is not good. So an unintended effect of too heavy a legislation is to be remedied, and so we hope that with the package, which is, I would say, a somewhat huge package, we will be attacking that issue, that type of shortages for IVDR or MDR, I would say, devices. We then, I would like to say, would also like to have in this drive towards simplification the possibility to instill clearly competitiveness. And here I come to a very important reality for the medtech sector. It's all about, or let me say mostly about, SMEs. These are small, medium-sized enterprises. We should be proud of them because they are, in Europe, the driving force in medical devices. You should see that when I meet with their representatives, the force, the imagination that they have. But, you know, of course, small medium enterprises have some handicaps, so we hope that this will also be addressed and addressed more broadly in this competitiveness agenda that the Commission more broadly has. You mentioned then the cardiovascular. I would say that perhaps before that I go into biotech, just to make you happy about the juicy part. So biotech, it's a huge request. The Commissioner was entrusted with this proposal. We hope to come out with a huge package that will make stakeholders happy. By stakeholders, I mean member states, the industry, but also the patients, because a lot of the future depends on having the cutting edge on biotech. I would like to say that this act will be very broad. It will have also AI into it. AI will be very important. You know that we have quite a lot at stake on AI, not just on biotech. But let me be clear, there will be also a huge part on clinical trials, which is very important, again, for patients. For patients, let me say to you, some patients, the only hope they have is to enter in the cohorts of clinical trials, you know.
Okay, and you've covered a lot of ground there, and
the
a lot of topics that I wanted
if you
to
let
get
me
into.
say one word on that, that one will be a plan. It has been leaked. I see that people have already tried to read into the proposal many things. It still has to come out from the college, so I will not comment on the leak, but it is clear that the Commissioner is very committed to attack this first cause of death in Europe. So let me say, after cancer, it was quite an obvious target
Yeah.
to have cardiovascular.
And looking at this, you talked about the reasons for the fast pace in the legislative agenda, this mandate. Some people in the health sector, probably some people potentially in this room, have raised concerns with us about the rushing of this, rushing potentially legislation. We're trying to simplify and not create more duplication and potential, overlap between legislation. We've had the Critical Medicines Act, and now we understand the first part of the Biotech Act won't be having impact assessments. Can you explain why this is?
But listen, in my book, there's no time to lose, and it's not me saying it, it's Commissioner Várhelyi himself saying it. And I think that if you look at what we are proposing, in some respects, this is most of the time simplification. And for simplification, there is, of course, very little that you can impact assess. You are at a stage where you are finding a problem. It's like you are repairing something that is not working in your house. So let me say to you, you have to consider this within the drive of other omnibuses and other actions that the Commission as a whole has taken, because we have realized that there is a big cry of let me say, help, relief, we can label it differently, by stakeholders saying we will be dying of legislation and there is a moment. What I want to stress though is that we are DG SANTE, so for us the first port of call is safety, and we will try to do all these simplifications without imperiling the safety of patients, but like I would say more broadly citizens, because you don't need to be sick. I mean, you can use many of these medical devices simply because you are, or in vitro medical devices simply because you are going for a service for your own, I would say, well-being. So for me, there is no time to lose, and I hope that if I will be again on this podium, I will be able to demonstrate to you that we were more than justified to go fast. And remember, there are many, many patients crying out to have health addressed fast, you know.
Yes, and I appreciate that. One of the other, just to stick with this topic, one more question. One of the other concerns we have had raised is that there could be a cost implication for member states from some of the measures in the Critical Medicines Act, notably by providing more manufacturing of products in Europe. They're more likely to cost more than outsourcing to Southeast Asia, for example. Do we have any idea in the DG SANTE what that cost uplift might look like?
Now, giving you figures would already give you the idea that I know how the Critical Medicines Act will end up with, with which sort of profile. I would like to say to you, though, that both on the side of the European Parliament and on the side of the European Council, I did not sense that the first concern was cost. On the contrary, the first concern is security of supply, which comes with a bit of a cost. There will be a big discussion on what is the final, where the cursor will be put on all the measures that we have offered for the two legislators to try to pick and choose at the end of the day a package that makes sense. But remember that the title of the legislation is critical medicines. So for critical medicines, we experienced a dire situation during COVID. And therefore, I think that at the end of the day, the memory of the absence of certain very banal, critical, I would say, medicines, therapies, gives us all a bit of headache. So we would like to be prepared. And the important thing is that, we will be prepared. And one piece of, I would say, of future that you need to know I'm very proud of is the Union Preparedness and Prevention Plan that will be taken out at the end of this year, again in December. And, my feeling is that it will give you the idea that Europe will be ready. This is not going to be the sum of the preparedness plans of the member states, but we are trying with the Health Security Committee members to project a safer, but also more secure Europe for any type of emergency. We will have, I would say, the chemical, biological, or nuclear risks included in it. We have all the health risks, including pandemics. So let me say to you, DG SANTE is working to make us all a bit more secure. And I think that at the end of the day, the Union plan will give us the preparedness that we need, or at least I hope.
Thank you. And you've brought us into the topic of health security, which I really wanted to speak to you about next. So we've got threats from infectious diseases, climate change, antimicrobial resistance, as it is celebrated today, natural disasters, hostile actors seem to be ever present, and the impact of growing rates of chronic diseases. What from this list do you think is the biggest threat to Europe's health today, and why?
Listen, it's very good you put me this question. I was in Helsinki at the big event on public health, and there was one of these sliders with the cloud, you know, and I was surprised because it was Helsinki. I'm not too sure if it was because it was Helsinki, but the first word that came on the screen was war. Very big. I said, I'm very shocked because there's prevention. I said, you should be pushing up prevention. So that when they asked me, what would you prefer to have seen? I said, prevention. Obviously, there is a competition in terms of finances. So this is why I suspect the word war came up, because there is an issue of the budget and choices need to be made. But let me be very clear with you. We are trying with the pharma reform, with the Critical Medicines Act, to give that edge of competition to stay here in Europe. Industry, you have all your sponsors here. I would like to say a thank you to them, because during COVID, it was industry that basically made Europe the pharmacy of the world, and we could help also other countries. So we are very grateful for that. At the same time, the member states need to have the budgets, I would say, in a certain shape if they want to be able to continue to buy the medicine. So there is this tension, and nobody has an answer or a single answer. There are many ways of going about it. I hope that really these two proposals will try to cover the space that member states of completely different, I would say, positions and situations need. You may have member states that are not receiving all the drugs that are produced in Europe, and so they are legitimately concerned about that. But you may have other member states that say, I want still to have my innovative industry still here in my country, located here, so I need that competitive edge. I would add into the mix the Biotech Act. I do not underestimate the fact that that will be a major driver of competitiveness. So we are in the hands of the legislators, because both, I would say, the pharma is in trialogues, and I would say for critical medicines, we hope we will be approaching soon that stage. And they, in their wisdom, they will choose, even going back to your tension moment, is it cost or is it security that we want? And, you know, the answer will be theirs, not mine.
Thanks for setting that. I mean, it's quite interesting, the different sort of priorities, if you like, for different member states.
Yes.
We are speaking at a time when competitiveness is arguably one of the mantras coming out of the Commission.
Yes.
We see that the work and the things happening in the United States are very much having an effect here.
Yeah.
They are, with regards to the pharmaceutical sector, threatening to cut drug prices significantly unless companies invest in manufacturing in the US, and have been threatening tariffs for a long time. Do you think we've got enough here in Europe to help counter this and to make sure that companies are still going to invest in manufacturing in Europe?
I think that one of the largest assets that we have is the fact that we have a single market, 440 million people, and most of the countries are in a public health sector. So public health sectors do buy quite a lot. So I suppose that we do have the ingredients. I think that in the mixture we need to put also the ones who pay for these medicines, meaning insurance systems and some Bismarckian systems, or I would say more generally, the taxes of everyone in the Bavarian system. So we need to be lucid that the conversation that we need to have with industry is there. We need to keep them interested in us. I hope that the many elements that we have on the table will keep them interested. As I say, it is a matter also for the members of parliament and for the council to see where the cursor stops, because competitiveness is not driven only by economic factors. It's also driven by projects. If the big project of biotech takes off and I hope so, together with the AI that goes with it, we can become the leader of the world in this. But we need to catch up. We need to catch up even in clinical trials. It's quite sad that in 10 years, more or less, I quote figures that everybody knows, we went from 23% of clinical trials share in the world to 12%. And this is, well, also because the denominator has changed. There are many more doing clinical trials elsewhere. But let me say it's also because we have become a bit burdened by and saddled by certain choices. But the conversation with industry, I see it as three actors. You have industry for sure. You have the ones who pay for whatever we will have in the health systems, and it's huge. The bill is huge. And then we have the king, that is the patient. Patients need to be, I would say, reassured that their system is giving them what they need, because votes come from there. So we go back, if you want as a politician to be elected, you will need to have happiness of your voters. Hence the need, for instance, of a cardiovascular disease. How could you not tackle that? So I could make you plenty of examples where I see that these three actors, when they converge, when they work together, so, you know, we have the regulators trying to give industry what it needs, and the ones who pay for the system trying to pay the right and appropriate price, because, you know, we have to have here conversations of affordability. But, you know, the one target is, for all of them, is having a patient that is happy, that is treated, possibly cured, and, you know, and it's the concern of DG SANTE every day.
Thank you so much, Sandra.
Thank you, Helen.
It's been a pleasure speaking with you, and
hopefully
we'll see you again.
It was an honor
next
to
year.
be here. You know, I read you every morning.
Thank you. If you can put your hands together to clap Sandra,
oh,
please.
thank you.
And I will
thank you. Even
welcome
an
Sarah
applause.
back on the stage. Thank you.
Thank you. Thank you.
Cheers.
Thank you. It was a pleasure.